Let's begin with a quote from the Secretary General of the United Nations. "The world of work cannot and should not look the same after this crisis." We are currently facing a crisis that is financially worse than the Great Depression and with perhaps greater physical, mental and health implications than the last World War, with lockdowns, social distancing and strict hygiene practices enforced worldwide. As if all this weren't bad enough, the casualties and death tolls have pushed some developed countries towards solving the outbreaks, while neglecting their humanitarian commitment towards developing countries. Well, who would you blame? This method can act as a good approach in rapidly stemming the tide of their own pandemic issues. However, several economic analysts are speculating that taking only this measure will have little to no long-term positive effect. Unfortunately, this statement is true because, first off, we are talking about a viral infection which, according to scientists, is 5 times more contagious than the normal flu and can remain undetected and spread for weeks even after infecting its host. Secondly, the world is interconnected in trade, human and material resources and infrastructure. So if the developed countries must exist and flourish, urgent measures must be made to assist developing countries in order to overcome their crisis. So what are these crises facing developing countries? Well, let's talk about 3 major crises. Number 1, increased health burden from other diseases like HIV/AIDS, malaria, among others. This is largely because of poor health funding and budgeting. It's easier for most developing countries with robust economic structures to spend 10 times more on their health sector than, say, Africa, for example, a continent just coming in terms with years of negligence, corruption and bad governance. Besides, there's a worrying spate of dwindling vaccinations as parents neglect their children's health checks since government hospitals are overburdened by COVID-19 patients. This negligence can lead to a future generation of adults who are highly susceptible to preventable and contagious diseases. Number 2, community spread. 60% of urban dwellers in Africa lives in cluttered communities. Taking the state of Lagos in Nigeria for example, with a population of at least 20 million, that would imply that at least 12 million people reside in cluttered communities. When you extend this analogy to other states and countries in Africa, that is the recipe for impending disaster. Number 3, another crisis facing developing countries is their debt burden. We are talking about 73 countries who rely on loans from international organizations like the WHO and IMF to boost their economies. These poor countries are plagued with debt financing commitments, which often make them to focus more on debt financing at the expense of their health and economic sector. At the moment, several measures are on the way to overcome these inadequacies coming from developing countries, such as access to COVID-19 tools accelerator funded by the Global Fund, World Health Organization WHO, amongst other partners, in order to facilitate the mass production of testing, diagnostics and treatment facilities for COVID-19 patients. Secondly, Global Alliance for Vaccine and Immunization (Gavi) is another organization that has fast-tracked vaccinations and immunizations in developing countries, by so doing reducing the disease burden and building a healthier global population. According to Dr. Ngozi Okonjo-Iweala, a development economist and former finance minister of Nigeria, she is also the board chair of Gavi and aiming to lead the World Trade Organization. She said, "I believe that the Americans know that they are benefiting from the WTO and the World Trade Systems. Other countries have also benefited." She also pointed the fact that it's important for all the countries of the world to be aware of their individual concerns and try to bring them to the table around common interests. Another notable personality whose efforts are worth mentioning is the UN Secretary General, who said he has called for a global response package amounting to at least 10% of the world's gross domestic product. For Africa, that means more than $200 billion as additional support from the international community. This and other global efforts, if implemented to the letter, will surely make the world recover from the coronavirus pandemic faster than imagined. Bye for now. You can also click the card above or the first link in the description in order to check out our brief summary of a drug that's making wave as a possible treatment and prophylaxis against the coronavirus.